Once you open up the patient, you get the cover sheet. On the cover sheet, you get details such as what's his most recent vitals, what allergies he might have, and this is also the location where any advance directives would be placed. In addition, in the top left corner is his yellow banner. If you click on that banner, you can get details regarding his address, his phone details, his next of kin, and one of the important things at the VA is service connection, a question that you may be asked about later on during his admission. The other locations to be aware of is at the bottom, look at the tabs. Here you can go to the Meds tab, and you'll find the inpatient medications the patient is on, and the outpatient medications the patient is on, and any non-VA medications that has been recorded. If you go to the Orders tab, this is where you can put in the orders. On the left-hand side are the choices, including the medicine service, which will give you many of the typical order locations. Also, the other specific choices you may have is medications inpatient, main menu IV fluids, medications outpatients, service consults, procedure requests, which includes ECGs and echocardiograms, and the radiology ordering menu. To write a note, you would go to Notes on the bottom. Here you can click on New Note to create a new note. If you go to Reports, which is the last tab, here you will get imaging reports such as CT scans and chest x-rays. You can also see what procedures have been done, such as including ECGs and echocardiograms, but also cardiac catheterization by clicking on Procedures. You may also want to get data from visits outside of the Boston VA system, such as if your delirious patient had a manual disimpaction 2 months ago, what were the lab tests there? To do that, go to Clinical Reports, and then click on Remote Data on the top right, and click checkbox the All Available Sites. This will load data from these other VA systems that this patient may have visited in. From here, you can go to a laboratory and then chem and hematology to look at his blood tests from these other locations. Choose at the bottom, you'll be able to choose the time frame for which you want it, a few days to a few months to a few years. You can also look at the pharmacy objects and other such factors. To look at current labs, go to the Labs tab. Here, the most recent option is what is chosen first, but you can also look at it in different ways by clicking on Cumulative, which will give you rows of lab data, or more specifically, you can go to Worksheet as another option and choose the group of labs that you would like, such as the CBC, and that will provide you a trend of the CBCs for a certain duration of time, which you can choose. There's graphing and microbiology, pathology, and blood bank data is all here. Details regarding the echocardiograms and to look at ECGs or images, you would go to Tools, and then to Imaging Display, and then click on Imaging Display. This patient does not have any ECGs or echocardiograms or any other imaging, but those choices would be available if the patient did. To look at an ECG, choose the ECG looking icon at the top here. To look at echocardiograms, then just find the echocardiogram, double click, and that will pull up the report, not the actual imaging itself. However, for chest x-rays and CT scans, it will pull up those images. The other details that you can find are previous discharge summaries, which are in the DC Summary tab, surgical notes from previous surgical procedures, which is in the Surgery tab, and then consult notes, which you can look in under the Notes tab, but also on the Consults tab, where consults are ordered. This is a brief introduction. Now please go figure out if the moon and lunacy are paired together.